Abnormalities in pulse character. Pulse character is best noted in the carotid arteries. The character of a pulse can suggest various pathologies. It is represented by waveforms. Various components of normal pulse pressure waveform correspond to the cardiac cycle. Systolic upstroke is the ventricular ejection. Systolic peak pressure is the maximum pressure in the central arteries. Systolic decline represents the end of ventricular contraction. Dicrotic notch is the effect of aortic valve closing. Diastolic runoff is the drop in pressure, which occurs after the aortic valve has closed. End diastolic pressure is the pressure exerted by the vascular tree back upon the aortic valve. Abnormal pulse characters include anacrotic pulse, called parvus et tardus, a low amplitude pulse or parvus with a slow rising and late peak or tardus, seen in severe valvular aortic stenosis. Collapsing pulse, also called water hammer pulse, and Corrigan's pulse. Checked on the radial artery, the patient's arm is raised to feel the pulse. It is a large volume pulse with a rapid upstroke and a rapid downstroke. Causes of collapsing pulse include patent ductus arteriosus, aortic regurgitation, arteriovenous fistula, and rupture of sinus of Valsalva. Pulsus bispherians. Pulsus bispherians is a single pulse wave with two peaks in systole. This is best felt in brachial and femoral arteries. Causes include aortic stenosis, severe aortic regurgitation, hypertrophic obstructive cardiomyopathy, and dissection of aorta. Pulseless Dicroticus. It is a single pulse wave with one peak in systole and one peak in diastole due to a very low stroke volume with decreased peripheral resistance. Causes of pulseless dicroticus include left ventricular failure, typhoid fever, dehydration, dilated cardiomyopathy, and cardiac tamponade. Pulsus alternans. Alternating small and large volume pulse in regular rhythm. Compensatory pause is absent. This is best felt in brachial and femoral arteries. Causes include severe left ventricular dysfunction and following paroxysmal tachycardia. Pulsus bigeminus. A pulse wave with a normal beat, followed by a premature beat and a compensatory pause, occurring in rapid succession, resulting in alteration of the strength of the pulse. Compensatory pause is present. Pulsus bigeminus is a sign of digitalis toxicity. Pulsus paradoxus. It is an exaggerated reduction in the strength of arterial pulse during normal inspiration, or an exaggerated inspiratory fall in systolic pressure of more than 10 mm of mercury during quiet breathing. Causes include cardiac tamponade, constrictive pericarditis, airway obstruction, acute severe asthma, and SVC obstruction. Reverse pulsus paradoxus is an inspiratory rise in arterial pressure. Causes include hypertrophic obstructive cardiomyopathy, intermittent positive pressure ventilation, and atrioventricular dissociation. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.